So let's talk a little bit about your experience with Robin. So what do you think that was the most valuable thing that you learned? So how was that experience?
What I learned, I didn't learn at the time. That may sound strange. I was young, very naive, and the undergraduate training that was offered was not very good. The basic sciences of anatomy, physiology were very well taught. But the treatment, how you went about managing patients, especially in the musculoskeletal field, was, I'm struggling to find the words, but incredibly inadequate. So those were the times of electrotherapy was very dominant. So if you were seeing someone with back pain, it was the treatment was more or less prescribed. They got heat of one form or another, but you could choose between infrared, microwave, or shortwave diathermy. So there was some serious thinking to be done there in deciding which form of heat. But so that was a very poor background to come from, and I think looking back, I probably found it a little overwhelming. I wasn't prepared for what I saw from Robin. He was so far ahead in terms of the way he carried himself. Physiotherapists at that time were a pretty downtrodden lot. The doctors, especially the specialists, the gods were the orthopedic surgeons. They didn't think a lot of physiotherapy. And the physiotherapists tended to be quite, I'm just trying to think of the word that would best describe it. They had fairly low self-esteem, but not Robin. He was totally different. He looked like an eminent specialist in his field. That's why he carried himself. That's why he portrayed himself. And he was able to mix with these orthopedic surgeons on a level ground. He could easily hold his own with any of them because he realized that they didn't know anything. So there was that part. And then the other part was he had an understanding, such a clear understanding of mechanical pain. That concept we hadn't been taught that. And what had been drummed into us was you've got to be very, very careful you don't make anyone worse. And so we were taught with a background of fear, which was really misplaced. I don't want to suggest that contraindications are not important. They're incredibly important. But the way that it was taught almost paralyzed the practitioners. You were scared to do anything. And so his approach was very different. And it took me a long time to come to terms with that. So I learned a tremendous amount, but I didn't realize I was learning it so much at the time. It was in retrospect when I was able to look at other systems and saw the difference that was the real value.
That's crazy. Imagine all this valuable information. You probably didn't even the idea of how big that was going to be, right?
Well, that's very true. He always said that in his wildest dreams, he could not have conceived of how things developed. He was at that stage, and we're going back a long, long way. 1974. He was best known for the development of the technique for the lateral shift, not for the McKenzie approach as such. And I think it wasn't until he sat down and wrote the book, the first textbook, Mechanical Diagnosis and Therapy of the Lumbar Spine, that he realized that maybe his concepts weren't quite as straightforward as he had thought. They were obvious to him because he developed them. They weren't obvious to a lot of people. They certainly weren't obvious to me. What I got by because I was a good parrot. I could repeat what I saw. I could repeat what he said, but I didn't understand it. That was the problem.